Hello, everyone. Let me get started. I just wanted to take this opportunity today to go through the personal care guide. I introduced it in a prior session, but I've gotten a lot of questions from practitioners about how we might choose to implement the personal care guide, or how we can help people on this path. As we've talked about, some of the questions came up in a member session and some of our program work about how important it is to try to reduce overwhelm and make this doable for people, and also to do so in a context of today, the current environment. Just there's always financial challenges, but even more so today, and really thinking about how we can make those better choices. So I thought that what I would do is walk through the guide again and talk a little bit about how I would turn it into activities or experiments that I could use working with an individual patient or client, to give you guys some ideas on that part. And if you have any questions as we go through, please just feel free to note them here and I will address them. Okay, so let me come on over to our personal care guide. And I think one of the things that's really important is for you to have a starting point with someone. Now, first of all, this content may be content that you are using in pieces or parts or in its entirety in social media or in other ways where you're looking to, to attract someone and bring them further along into becoming a patient or a client. So in doing that, there are some activities that I'll talk about here, as well as, also doing activities that and experiments that you can do with individuals once they already are your patients. So one of the things that is really a great opportunity here is to start off with asking people, what they have concerns or questions about, or what they might suspect to be misinformation or confusion. One of the ones that I was pointing out just recently is the prolific use in marketing today of plant-based, of the term plant-based. So you'll see things, and I think there's a soap company that talks about how their products are plant-based. While great and certainly aligns with people's values, in instances it's also being used as a way to sort of ascribe a health halo and also a sustainability or an environmental safeness that it may often not be accurate, because while ingredients in skincare, in personal care, in chemical, in cleaning products, et cetera, may be plant-based, but not, but what's been done to them makes them no longer good for plants, good for the environment, good for us, in that capacity. So one activity or experiment could be to just ask individuals, what are their questions, their concerns about personal care, cleaning, textiles. Another would be to certainly separate these out into different groups, and to really talk about things like, what do you think your body has exposure to most frequently? So within personal care, to sort of rank the different things in terms of how much of your body they're touching, how often, how they might get into the body. It could be really valuable to point out that many of these ingredients, when they're coming into the body, are circumventing the body's vetting system, our digestive system. And so as a result, they may be more impactful, and also not be alerted, that they may not alert the body as quickly to things that are not helpful and could even be, we'll use the word toxins or toxic to the body, and damaging to the body in that capacity. So that's one of the reasons, to point out and to look at diving into this. There are other things, and if you're a member and you watched your video session with Amy Ziff from Made Safe, or if you caught on, or if you want to go over to the Better Nutrition Program's Instagram, we have our interview discussion there, and we talk a bit about how certain things may be noted as biodegradable, but they may actually not be biodegradable in most environments, and so that's super annoying. Certainly from when you're making decisions about things from a safety standpoint, or a sustainability standpoint as well. So I think that's something important for us to pay attention to. But what I might want to do from an activity standpoint is, so first of all, if somebody has concerns about things, we could start off with a not better list, and we could ask them to just identify, just go through your purse. So if you're going through your purse, I could go through that exercise right now, although my purse is actually pretty empty, and pull something out and say, just read the label. So are there any of these ingredients on things that are in your purse? Because the likelihood of things that are in your purse are things that maybe you would be using more often, right? Or in your backpack, or if you want to do like at your desk at the office, or one of those things. So that could be one great activity to do, which is just to start with, and start looking at it. I had somebody who said to me, as a parent, it was actually, they were much more focused on, for their kid initially, their child initially. So what we started off with was the bathroom for the child. So what are the things that are in the bathroom? And we just went through first personal care, then we went into cleaning products on that part. So first, you can use the Not Better list that way. The other thing that you can do is you can also do an audit to see, hey, do these logos appear on any of those products? And those may be easier ones for you to, be able to look at and say, okay, like I see I have something that's Made Safe certified, or I see that my supplements or, my skincare has NSF on it, et cetera. So there are some things on here that I know, have those better standards. And then what I like to do is I like to just pick that, so as I was saying, especially when it comes to personal care, just pick like one part of the body. And this can be a conversation. So say that you're working with somebody on digestive health, or you're having a conversation, you're trying to move them into becoming a patient of yours or client of yours for digestive health. Well, one of the things that you could talk about is just the importance of oral health and how our digestive system actually starts in our mouth and our microbiome starts there. So that would mean that things that we're doing, toothpaste, mouthwash, I would also even put on it, it's not on here, but it's something you could certainly add and review, things like dental floss, right? So if I'm looking at that and I want to see like what ingredients on here, do I see any of the foaming agents? Do I see any of the antibacterial agents on there? And just go through and identify that. And then one of the things that I think can be a really great tool to communicate or a way to help people feel better about trialing things. Number one, of course, they can, when you identify products that are the better options, you can see if anybody does sampling. But you might also want to say to somebody ahead of time, what's a reasonable amount that you feel like you would be comfortable allocating either on a weekly or a monthly basis to trials? Like, so somebody might say, I could probably trial something for $5, or I could trial it for $10, or somebody might say on a monthly basis, I have $20. And then we look at that and we say, all right, so this month, why don't we look at our soap and our toothpaste, or our mouthwash and our toothpaste, and we'll just cover off the mouth on that part. And so then we would look at, if we've identified products that are in here that any of their products have these ingredients, and we're now looking for options to improve, then we could look at a variety of options and they could choose. And I always try to recommend, unless there's one that you think like, absolutely, this is the best product, I think they're going to love it. I usually will say, get like 2 or 3 in the travel size and then see what you think. Like, do you like the taste of them? Do you like how it feels in your mouth? Do you, et cetera. And then do that as the trial. And then once they know that they like something from a trial standpoint, then you could do something like a subscribe and save, or you could get the bigger container or whatever to help them on that part. You may also be able to identify things within here. Maybe somebody has been using mouthwash, and you're able to talk to them about things like oil pulling. And you could do oil pulling with an essential oil, for example. So you could do coconut oil and mix a little essential oil in there. Or I happen to like orange a lot. And so you could do that, and then they might not need the mouthwash on that part. And so that would be a good discussion, where you could say, oh, we've reduced artificial colors, we got rid of triclosan, and you actually have coconut oil at home from a cooking standpoint. And so you can just take, a cup of that and put it in a container and put some of the essential oils in there, or just have it plain coconut oil. I oil pull with plain coconut oil all the time, and that would be something that you would be able to use. So you might find a way to actually remove a product from them as well. So I just want to pause and see if there are any questions on that part. Is that making sense and resonating in terms of kind of how we can work on this with individuals, or if you have any questions that are popping to mind about the notion of like how we can do experiments, now's a good time to ask. Otherwise, I'll keep going through them. Anybody have any questions? I think the overarching, I kind of have 3 areas to be thinking about: trying to reduce overwhelm, not add stress; trying to address what their personal concerns or questions or beliefs. So somebody sort of, why are they here? Are they here because it's an environmental concern? Are they here from a health standpoint? Obviously, we know the interaction of health and environment. Are they concerned more for another family member versus themselves? And so that might drive more of the cleaning product conversation, because if they're cleaning the home, the kids are in there or the dog's in there, it's going to matter on that part. Are they focused on their skin from or their body from a performance and aging standpoint? So what's going to be the entry point, and what do we want to answer there? And then the third one would be, how can we sort of break the trial into something that is manageable. So a specific amount, that feels manageable. So as I said, something like working on oral health, or working on, from a deodorant standpoint. And, one of the things like with breast cancer, for example, so say that you were doing this thinking about this with October and Breast Cancer Month, breast cancer awareness. You may want to combine things from a couple of different areas. So you might want to look at deodorant, because deodorant, when applied, is applied very close to the breast, and we know the lymph nodes are there, et cetera. But we also may want to look at sports bras in that capacity, or sports bras and the period panties, and have the whole conversation about, just in terms of, reducing exposures in that capacity. So we may be able to pull from different groups, and we may also be able to say, from a cleaning product standpoint, this particular being able to reduce exposures to this particular ingredient has been shown to, decrease risk associated with breast cancer. And so that's how we do it actually in our cancer risk reduction program, one of my absolute favorites, and the driver behind creating this tool for practitioners, is because we have these different activities in that program. So that's how I would focus in on an area that ties directly to something that they're concerned about, that would feel like they can understand from a measurable impact standpoint how this is going to be doing better. And then I guess the fourth one, which I mentioned about, is how do we budget for it? So how do we improve upon that? One of the best ways to work on budgeting is one of the things I was just mentioning, which is, if we're talking about mouthwash and we identify that their mouthwash has all these ingredients in there that aren't better for them, do we actually need mouthwash? What's the role of mouthwash? And so as we're optimizing, maybe their toothpaste is a good toothpaste, we could be thinking about, what are you trying to accomplish from a mouthwash standpoint? So what are we doing in terms of, dental floss? Are we doing in terms of, getting are you using water pick, these kinds of things? But there are definitely ways, if one of the attractions with mouthwash was actually, if they feel like throughout the day they have bad breath, that's actually the mouthwash is actually a Band-Aid for digestive issues. And so we want to actually walk through that conversation and talk a bit about how can we actually improve oral health and improve breath, which is the thing that they're concerned about. So those might be things like the role of of liquid chlorophyll. It could be lemon water. So it could be your alkaline formers, lemon water, limes. It could be, especially in conjunction with things like, when I have coffee, then I do this. I was mentioning oil pulling just a moment ago. So, essentially what we're trying to do is really put things together in a way that helps them understand that maybe the product they were purchasing and spending money on is actually something that is a Band-Aid or isn't going to be needed as we address other issues. And maybe there's something that's an easier solution from a cost standpoint, because if I already have coconut oil in the house to cook with, or if I don't already have coconut oil in the house, and I can say, so some of the things you could do with it, you could cook with it, you can use it, you might put a little on your skin and dry patches, you can use it in that capacity. So it takes away, maybe you don't have a good lotion and you need to replace the lotion, and you could use it for oil pulling. Now somebody's going to start to see financial savings, and also just easy, in terms of not needing to have all of these products. So to me, that's a great win on that part. All right, I'll go back to sharing examples, but if anybody has any questions, please feel free to ask me them. So that's how I would go through these different areas, kind of look at that piece. One of the ones I think is often really difficult is shampoo, conditioner, but more importantly, like the styling products, because a lot of times people are go into a grooming place, like where they get their hair cut, et cetera, and are recommended or even sold products there because the person makes their hair look so good, and you're like, oh, I want to be able to do this at home. But we don't end up, or somebody says, oh, it's plant-based, or oh, it's natural, or I love this product for this, and then you get home and you look at it and you're like, wait a second, like there are all these, unfortunately, these ingredients in there. So what choices do I have to make, and how could I do better on that part? So, I think with hair color and styling products, depending on where someone is from a health standpoint, depending on how frequently they're doing hair color, depending on how frequently they're using styling products, this is going to be one that would be very individualized in terms of whether or not you decide that that's a focal point. Likewise with makeup, if somebody's wearing makeup once, 2 or 3 times a month versus if somebody's putting on full makeup every day, that's going to be a good, distinction in terms of, do you prioritize that as high as, say, deodorant or bug spray or, something else like that. And likewise with the cleaning products, I think that this is one, I actually thought it was great in the conversation with Amy Ziff from Made Safe yesterday, where she was talking about, and she just said, too often, and we know this, and I definitely know this working with companies, they're looking for you to use their products more often. So they're trying to make different products for different usage occasions. My favorite one is the baking soda, right? And they now have the baking soda that you use in the refrigerator and the freezer. And I remember, I think it was my dad, and I was like, oh, I just need baking soda for to clean a pan. He's like, well, you can't use that. That's the one for the freezer. And I was like, it's the exact same product. It just has the way that the package opens up is different. It has those, the netting for it to breathe on in the refrigerator, in the freezer. So, it's important for us to think about, do I need all these different products, or can I use one product that is a clean, good quality product and be able to use it in multiple different places? And that also, the more that you can help people budget effectively for, being able to use things in multiple places, et cetera, that it's going to help them feel like it's just this is easier and it's doable, which I think is, just so important on that part. Textiles are a really important one, especially for people who are dealing with any skin-related issues. That should be the obvious. But also, one of the things, and again, this came up in the conversation with Amy Ziff, that you can watch on our Instagram, or if you're a member, you can watch the extended version in the member session. That is really important for us to be thinking about is as women, for example, go through menopause, perimenopause, there are certain, or for athletes or, just different, there are certain materials that don't let the body breathe as much, or that don't help with your body, the detoxification and the work that your body is trying to do naturally. And so that's going to be really important on that part. It's kind of I've had a lot of parents who have said to me, they're really focused on the mattress for the baby or for their, young child. And they may not have focused on their mattress, those kinds of things. So really important for you to sort of think about and talk to them about life stage in that way, and thinking about what is more doable in that part. Okay, so that was really why I wanted to dive a little bit deeper into this topic, because I had those questions come up just about how can we be using this guide, and how can we have conversations as practitioners with our patients where this feels like something that's part of what we're doing. Said differently, I think we need to frame it as something part of, the overall, and not kind of segment it the way that, kind of sometimes food and supplements, they get segmented instead of those being your total nutrition, right? And then it's food and supplements and skincare. Really what goes in and on your body is going to affect your system. So that's really also part of your nutrition. So when we're having conversations with people, explain to them why we're going to be diving into this, and not just because we're trying to in each of these different areas, trying to help them be better, but really how it's overall part of their healing and the getting and staying healthy on that part. Okay, so I will pause there. We've got about 10 minutes. Does anyone have any questions, any business questions, anything else that I can address or be helpful with? Ask me now, or enjoy 10 minutes of your day to go do whatever it is you want to continue doing. No questions. All right. Well, then I'm going to go back to about my day on that part. And just a reminder for anyone who is watching this live or watches this week, we do have our summer sale going on. It's our opportunity to gift you all, or anyone that is in your orbit, a free program. We are just trying to help support people who want to be proactive in working on their health. And as we're jumpstarting programs, we thought this was something that we could do right now. keep just watching the news and how challenging the times are right now. I thought this was something that we would be able to do. So if you are interested as a practitioner, by all means, you can sign up for a program yourself, or if you know someone who may benefit. We had a colleague who signed her husband up because she was like, my husband's not going to listen to me, but I hope he listens to you guys on this one, that kind of thing. So here to help, and you can take advantage of that through the link that we've shared in the group, or also it's on our social media with the code BETTER. And it's just available to the first 20, and I think we've had about 10 already sign up. So going fast, but hopefully you'll be able to take advantage of it. All right, take care, everyone, and I will see you soon. I'll see you next week. Bye.